certification, then they'll be also paid 10,000 per bed per year. So this NQAS certification is for a period of 3 years. So for the next 3 years, the institution, whoever gets this NQAS certified will be paid this 10,000 per bed for the next 3 years. But every year there will be an internal assessment. And after 3 years is complete, again we have to go for national certification, recertification again. So CHC and equivalent same, if there's a conditionality, instead of 10,000, they will be paid only 7,000. Another is UPHC and BHC with bed, they'll be paid 3 lakhs per year. Without BHC, in all departments with conditionality, if they get only 2 lakhs. And then UPHC without bed, PHC without bed will be 2 lakhs. UPHC without beds will be 1.5 lakh. And now from this year onwards, Health and Wellness Center, Sub-Center, they also, if they get full certification, that is 18,000 per package. So depending on the number of packages in a particular Health and Wellness Center, you'll be getting per package 18,000.
Trainings and of course after that we realized that there are a lot of things to be done, and we went through the checklist of all the 12 departments. We went through the checklist of all the departments, and then the staff were given equal responsibility for taking care of all the respective departments that they are interested.
Won in the year 2019 and in 2020 in a row. So winning the Kaya Cup award meant we had already achieved 20% of what was needed for NQAS certification. We knew that it would be a long journey, and there were several rounds of assessments, staff reorientation trainings, and working through holidays, working through Sundays, and even on national holidays. We even worked through a global pandemic for 2 years, and finally, in the year 2022, we achieved the NQAS certification award, the first PHC in Nagaland.
Our NQAS journey started in the month of August 2021 after the training of MOs at the district level in CMO office, and then training of staffs at the health center. NQAS as such was new to us and my staffs because the previously trained doctors and nurses, some resigned and some got inducted into the state service. We began with the cleaning of our health center, as the center was in a mess with the building of new rooms for the X-ray machine, and also because Kaya Cup inspection was coming. We did our internal assessment in the month of November. We first did in the month of September and then in the month of November, but there was not much difference. In November, we scored 76%, and this was sent to the district level. Another gap is that we needed several trainings to update ourselves, and also this was required for NQAS certification. Many trainings. This was possible because of our CMO and Deputy CMO, along with our Quality Manager, Dimapur. They organized and we could conduct these trainings.
The target given by Government of India so far certification of urban PSCs are concerned. How many urban PSCs are in Nagaland? 7. Already certified? 3. Because the PSC in Mokchong is it an EPSC? So it is 3. So 3 out of 7 is more than 30%, I will say. So the target is 25% now. So we have achieved it. And I must congratulate the medical officer, not only the medical officer, also to the staff of those 4 facilities, including Shikajo also. And side by side, I take this opportunity for apologizing to you all for creating lots of pressure on you. But I cannot afford to be relaxed because pressure has its result. Now today you people are happy. I'm sure you are proud. Na? So sir, congratulations to you also. Again, and I'm very happy that Nagaland is also shifting from Naga Telehealth to e-Sanjeevani in coming days. Today it will be launched. So it's good. And due to the COVID pandemic, I will say, there is a long gap. I had an association with Nagaland for last 12-13 years. Or more than that, maybe 2007 onwards. So I could not come for last few months because of the COVID pandemic and restriction. On arrival this time, we are very happy to note that drug position. The availability of the drugs in the facilities is really good. And the pharmacist, ma'am, I would like to inform you, and sir also, they are keeping it as it is expected, storing it nicely and utilizing it also. It's improved a lot, as well as the cleanliness, obviously. All these things are happening. It's obvious from the field visit that, yeah, there is an effort to improve the situation. Further, I must say one thing that 15th FC, you all know, and the Prime Minister, PMA VIM, Health Infrastructure Mission, there are plenty of money in this. So we should not miss this opportunity to make us self-dependent, self-sufficient. So far in the field of diagnostic network, if somebody can show our authorities 2 slides that what the PMA VIM are giving and what the 15th FC are giving, then it becomes very easy to understand that these 2 schemes are for strengthening of health infrastructure and diagnostic network, a robust diagnostic network. Some are being funded from PMA, some are being funded from 15th FC.
I would like to compliment not only the 3 health centers who have achieved, but the 4th one, including Shikazo, 2 in Timapur, 1 in Kohima, and 1 in Mokcho district. Now you have done a commendable job, as you have shown in the slides. You have gone through all the hardships. But as you all know, this assessment is to assist our work. To check back in how we are doing. What is our score in our workplace? For me, I understand that way. I don't know whether I'm right or wrong, but this NQAS is to assist our work. Therefore, I think each and every one of us have a pushing there. While complimenting the commendable job by the 4 centers, we also need to reflect whether we are satisfied that we could achieve for only 4 centers till today. When the program was launched 9 years back, and we are still on it. Where do our district headquarters hospitals, the community health centers, the other health unit stands? Where are we today? Unlike I've worked in many departments, this department has a unique feature. For every step we take, for every implementation, we get assistance from the ministry. Other departments are not like this, okay? we have 3 programs, 4 programs. But out here we have nearly 30 programs, right? For every step, from our salary till the needle, we are being fed by our ministry. So, of course, our government of India, the number of programs governing throughout the country is based on the assessment taken from all the states, irrespective of the bigger states, the mainland states, or the remote states like ours. But the objective is the same for all the programs.
In alignment with the national health policies aim to ensure universal health coverage, Ayushman Bharat was launched in 2018 with Health and Wellness Center and BMJ1 Pradhan Mantri Jan Arogya Yojana as its 2 strong pillars. Ayushman Bharat aims to bring standard shift in the country by increasing health systems responsive to the increased demand of health seekers and prevention and treatment of diseases. The state have completed 4 years of implementation of the prestigious Ayushman Bharat Health and Wellness Center in Nagaland, thereby bringing quality care close to homes of community with the provision of expanded ranges of services in the entire state of Nagaland. Along with making healthcare services available, accessible and affordable to the local population at their doorsteps, it has become more pertinent to ensure quality of care provided by health care providers is feasible and acceptable. Therefore, the Ministry of Health and Family Welfare began its journey of ensuring quality across the public health facilities since 2013. And now, with the launch of National Quality Assurance Program under the embargo of standard of care for various level of health facilities at district hospital, community health center, primary health center, and sub-center has been tried. In Nagaland, Sikojo Urban Primary Health Center is the first facilities to be certified by NQAS in the year 2019. Interestingly, this year, 3 additional facilities were certified. That is, Dangan Urban Primary Health Center, Mongsemdi Primary Health Center, and Roma Game Urban Primary Health Center,
which was a state customized model since September 2020 with the support of the USAID, NISTA and JPICO to ensure continuity of essential services. However, with the directive of the Ministry of Health and Family Welfare, we are shifting now from Naga Delhi Health to national platform, that is e-Sanjeevani Teleconsultation Services. e-Sanjeevani is a web-based comprehensive telemedicine solution which works through 2 platforms. that is health and wellness platform, and the other one is the general OPD. Health and wellness platform is where the general public, a patient, can visit the health and wellness center and get the help of the CHO, who will take the history, do the basic investigation, and conduct live teleconsultation with the doctors. It will function as in a hub and spoke model, where the hub is the doctor, will be the doctor, and the spoke will be the health and wellness center. The second platform will be the general OPD platform, where the patient can directly consult a doctor from the comfort of their homes. So these services will extend the reach of the specialist healthcare services to the masses in the rural areas and isolated communities in the state. Ministry of Health and Family Welfare aims to implement teleconsultation in all the 1.5 lakhs health and wellness centers in the country. E-Sanjeevani also aims to make healthcare services equitable by bridging the digital divide that exists between the urban versus rural, rich versus poor, etc.